Let's continue with some female reproductive anatomy and physiology. Notice how we were able to get all the male done in one annotated PowerPoint. Females, it's going to take two. That's because women are so complicated. Oh my God. Breast is an accessory structure consisting mostly of adipose tissue. You'll hear people say the breast is the mammary gland. The mammary glands are inside. See on the left illustration rather, see how there are those lobules of the mammary gland? The breast is just basically a big blob of fat. That's all it is, that bounces and jiggles and, whatever. And the mammary glands are inside. Latin word for breast is mama. That's how we get the word mama. Mama kept you alive after you were born with her breast, so pretty damn important structure. Mammary gland develops during pregnancy, remains active during lactation, then atrophies. So it really basically only shows up during the latter part of pregnancy, lasts throughout lactation, and then goes away. That's why a woman who hasn't recently been pregnant can't nurse a baby. Only women who have relatively recently had. Of course, lactation may last for up to 3 years, so it can last a while. But the nipple is the structure where the milk comes out. And by the way, it's not like the nipple on a baby bottle where there's just one opening. There are lots of openings, all right? We'll see that, I guess, here in just a moment. The dark area around the nipple is the areola, okay? And mammary gland develops with 15 to 20 lobules. Each one is drained by a lactiferous duct which drains into the nipple. So there can be as many as 15 to 20 lactiferous ducts that all lead up to the nipple. So that's why during nursing, then, there's not just one opening, there are a bunch. And so since I'm married and my wife had children, I got to see this. During nursing, there can actually be many little tiny bubbles of milk on the nipple. I mean, they all normally fuse together into one. But you can kind of see, if you look carefully and, watch for a minute or two, you can see that there are several different openings that all produce milk, and then they all are merged together so the baby can get a good drink, all right? And there you go, not homeless, need boobs, all right? And that reminds me of my former student Lacey here. Lacey, the one who's right next to me on the left. I went to their nursing school pinning, their graduation, so to speak. But Lacey was great. When she was in my class, it was obvious from day one that she had breast implants because she was really proud of those things. And, she always wore low-cut tops, and, she held them out in front. When Lacey walked into the room, her boobs came in first, and then the rest of her came following behind. So when we got to this part of the class, and someone asked me in class about, implants, I looked right at Lacey and I said, Lacey, can you tell us anything about implants? She said, I'd love to. And she said that she started life as a 32A, and she had 2 kids, breastfed them. And she said by the time she got done breastfeeding 2 kids, it looked like she had 2 fried eggs nailed to her chest. And she said, girls, you deserve better than this. So she saved up some money, went to the plastic surgeon, and she says, I want to turn these 32As into 36Cs. And he said, we can do that. So there's Lacey, just proud as hell of her big 36Cs. And why not, girls? And there's Dawn. Dawn also had some enhancement. So I kind of got a picture of Dawn's. In her case, it was basically just after breastfeeding, they had, kind of become a little, floppy. They got a hard workout from it. I think she breastfed 3 kids. So, but Dawn, basically, in her case, she just wanted to restore them to normal, to their natural condition. So that's what she did. So, I think they look great. And, ladies, that's what's going to happen to all of you. Over time, kind of like a rule in life, as you get older, things that are supposed to be stiff get floppy, and things that are supposed to be floppy get stiff. So, like arteries for the latter one. But, that's what's going to happen, ladies. There you go, 2012, 2013, 2014. You can chart it on the wall, just like you do with the height of kids. All right, so breast cancer, 1 out of 8 American women. Tumors begin with cells from the mammary ducts. They can metastasize to the lymphatics. So remember, you got lymph nodes, axillary lymph nodes, And the remember there was the subclavian trunk. Ooh, there's a siren in the neighborhood. Subclavian trunk that passed through the axillary nodes, and what can happen is the breast cancer can travel then through the lymphatics, infect the lymph nodes, and that's oftentimes why in when they do a mastectomy, they'll remove the breast. And just to be sure, sometimes, I mean, I don't know the exact surgical decision making, I'm not a surgeon, but apparently they will take out those axillary nodes. Symptoms may include palpable lumps, skin puckering, skin texture, and drainage from the nipple. Most breast cancer are non-hereditary, some stimulated by estrogen. That's why postmenopausal women, at one point they were using estrogen replacement therapy, but then there were indications that it was connected to breast cancer. That's why now a lot of times they just do the vitamin D and the calcium. But now there are lots of markers for breast cancer, so they can tell whether you have an estrogen type cancer or not, and so on. It's much more complicated than I know about, but they're pretty good now at figuring out the breast cancer and deciding what's going on, figuring out how to treat it, and so on. So risk factors include aging, radiation, carcinogens out in the environment, alcohol, smoking, fat intake. But a lot of women, 70% was the figure I got from whatever article I looked at, lacked risk factors, and so therefore it's just really hard to tell. That's why they say, ladies, feel your boobies, all right? Keep checking to see, all right? Now, then there was some research that came out a while back that said, no, they wanted women to stop doing that, because a lot of women were just feeling these benign cysts, and they were apparently flooding the offices of the doctors, and they were going like, stop, these are false alarms. And I'm thinking, you idiots, who cares if they're a false alarm, for God's sakes? If you catch the breast cancer, isn't that what doctors are supposed to do? I don't know, maybe there's more to the story than I know, but I can't believe they actually told women to back off and stop doing it. A lot of women are afraid of breast cancer because they're afraid that they'll become, disformed, disfigured, whatever. But nowadays, a lot of times they schedule the mastectomy right at the same time. I mean, they schedule the reconstruction at the same time they schedule the mastectomy. So they do it kind of all as one big job, and they've gotten really, really good at it. There you see a woman who had a mastectomy and they did a reconstructed breast. They're even better than that now. So ladies, go ahead, feel your boobies. Don't be afraid to go to the doctor if you feel something that's not right. And if you got cancer, it's not the end of the world. They can do a great job of restoring them. Now, they're really good at that. So please, don't get cancer. All right, puberty, begins around age 9 to 10 in the United States. So this is kind of a recent evolutionary phenomenon. It used to be like in ancient times, puberty didn't happen until much later, 14 maybe, something like that. You normally didn't want puberty to happen until women were of childbearing age and large enough that they had already started into, the other developments. But apparently it's just the really good nutrition that we've got now and some other things. Some people said it's the fluorescent lighting. I don't know about that. But apparently the onset of puberty has now gotten really young. Girls as young as 9 and 10 are now hitting puberty. Triggered by rising levels of gonadotropic releasing hormone, all right? That just naturally, puberty stimulates that. That stimulates the anterior lobe of the pituitary to produce follicle-stimulating hormone, luteinizing hormone, and then the follicles develop and they begin to secrete estrogen and progesterone, and this begins the whole transformation of girls into women. So there are different parts of puberty. Thelarchy is the development of breasts, all right? That's often one of the ones that comes early on, all right? Pubarchy is the growth of pubic and axillary hair. Apocrine and sebaceous glands become active as well. And then menarche is the first menstrual period. Requires at least 17% body fat in a teenager, 22% in an adult. I'm sure those numbers are relatively approximate, but I told you before about the girl I used to go hiking with who would hit me, when I insulted her. She was a wrestler in high school, and she was a really good wrestler. They didn't have a girls' wrestling team. She was on the men's wrestling team, the boys' wrestling team. And she was she was ranked like 8th in the state of Wisconsin in her weight division or something. So she was really, really good. But during wrestling season, she would really, she was working out hard, watching her diet. So her body fat would go so low that she would stop menstruating for, 8 months at a time. Like during the off season, she'd gain a little bit of weight. a period would come back. And this happens a lot to the Olympic athletes as well. Sometimes on the Olympics you'll see a girl gymnast. She'll come up and she looks like she's 12, and they say she's 17. You're thinking, oh my God, 17? She looks like she's 12. In many cases, it may be that their hard training regimen and their low body fat has prevented them from ever entering puberty. And there's controversy about this, about whether or not that should be done. Low estrogen levels are apparently, at least possibly, leading to a lot of the bone fractures. I'm sure you've seen this. The gymnasts break bones a lot. So I don't know. Just some background information. You decide what is or isn't good or bad. But there has been controversy about this, about overtraining these young girls and actually messing with their puberty. All right. Leptin stimulates gonadotropin secretion. Improved nutrition has lowered average age to 12. That's for all these things to start happening here, for the change in the hormones and the body hair and the menstrual period and so on, all right? And then at the opposite end, females, there's a time at which females, basically, their body, evolution has decided their body is really no longer capable of bearing children. So your body basically stops you from doing that. And everybody calls it menopause, but I want you, at least for this class, to know that technically it's called the climacteric. Menopause just refers specifically to cessation of menstruation, all right? Remember, there were the 3 parts of puberty. Well, there are different parts of the climacteric as well. Menopause is just one of them, all right? This is related to the age-related depletion of follicles. So basically, the eggs run out at some point. Average age of onset, early 50s, all right? That can vary considerably again. But what happens? Atrophy of the uterus, of the vagina, and the breast. So the breasts and the vagina especially will start to shrivel up. Skin becomes thinner, bone mass declines, risks of cardiovascular disease go up. The hot flashes, sudden dilation of cutaneous arteries occur several times a day. And the illustration just goes to show you, look, women put in all this work in order to keep the damn species alive. They squirted out the little parasites, they suffered through it, they nursed them, and look how nature repays them. Headaches and hot flashes, teeth loosen, gums recede, cardiovascular disease, backaches, pubic hair and skin become thinner, darker, loss of bone mass, vaginal dryness. A lot of women find sex unpleasant once they hit the climacteric. Increased need for some artificial lube. And again, hormone replacement therapy is one thing that they have tried in the past, but this is controversial because of the increased risk of heart disease and cancer. So a lot of times now, in order to deal with the osteoporosis and stuff, it's vitamin D and calcium. My wife, 72, has been taking vitamin D and calcium every day for years, all right, in order to try to prevent the osteoporosis. And there you have the 7 dwarfs of menopause: itchy, bitchy, sweaty, sleepy, bloated, forgetful, and psycho. There are some psychological changes that accompany menopause. It's not surprising. Just, guys, look, your wife did a lot for you throughout her years, and when the climacteric comes, you better be nice, damn it. She earned it, okay? So, oogenesis and sexual cycle. Root word means egg. Oogenesis, and that means the creation of the eggs. Really not the creation in this case, but development. So the reproductive cycle are the events occurring between fertilization and birth, all right? The sexual cycle, on the other hand, occurs every month when pregnancy does not occur. So do you get the difference? Reproductive cycle, fertilization to birth. Sexual cycle, that's the monthly bill coming due, all right? So you have the ovarian cycle, which are changes in the ovaries, and the menstrual cycle, parallel changes in the uterus. They all fit together. And by the way, this diagram right here, this illustration, this is the one. Make a note of this. Put a big asterisk on this slide. This is the one to come back to. So look at FSH, follicle stimulating hormone. So first of all, notice the female cycle, the mythical 28-day female cycle. Some women have very regular cycles, but they don't have to be 28 days. Some women have very irregular cycles, but the textbook number is 28-day cycle, even though that's not true for all women all the time. Ovulation considered to happen on day 14. All right, again, this is just kind of an average number. This is the way it usually works. Okay, so day 1 through day 7, this is when menstruation occurs. All right, and so this is when you're basically clearing out the previous missed attempt at making a little parasite. So notice that FSH is high. That's because you missed the last time, so we better start getting ready again. Let's get the next egg ready. Do you get it? That's what FSH is doing. It's saying, let's get the next egg ready. And then estradiol, which is the principal estrogen, it's also high during this time. Estradiol helps with the development of the egg and the development of the tissues of the uterus to prepare for implantation of the egg. So just remember this. FSH and estradiol, estrogen in general, are high during the first half of the female cycle. Then, day 14, look at luteinizing hormone. Boom! It's been low all the way through up until now, and then it spikes. Here comes the egg, okay? Notice estrogen also spikes. But then look what happens after ovulation. Notice FSH drops down. Why? Because we're currently working on the current egg. We don't have to get the next one ready yet, all right? We just ovulated, all right? We can take a break before we prepare the next one. And then look at estrogen. Likewise, it drops off, all right? It's done preparing the uterus for implantation. Now, look what happens, though, with progesterone. This is when it kicks in. Progesterone is either going to help get rid of the tissue if we didn't get pregnant, or it's going to help with the initial preparations for the development of the fetus, okay? So just take a look and remember, FSH and estrogen high during the first half, drop off during the second half. Whereas progesterone low during the first half, it jumps up during the second half. This is also the females who take the oral birth control pills. This is what they are. They're often estrogen progesterone pills, and they're based on the female natural cycle of estrogen and progesterone. Okay? So oogenesis, monthly event, produces haploid oocyte by meiosis. Okay? So embryonic development of the ovary, female germ cells arise from the yolk sac. They differentiate into oogonia. Remember, we had spermatogonia. Transform into primary oocytes. That's early meiosis 1. Most degenerate by childhood. All right, so women start off with whole bunches of them, but childhood, they all just fade away. By puberty, you've got roughly 400,000 left. Thank God you don't have 400,000 babies, but this is what's going to happen. Now, each month, you're going to get a different one ready to go. So FSH stimulates completion of meiosis 1, produces secondary oocytes and first polar bodies. That proceeds to meiosis 2 and ceases until fertilization. After fertilization, it releases what's called the second polar body, and that's what's going to move on. That's what's going to get fertilized. All right. So plants do the same thing, by the way. The first polar bodies, the second polar bodies. We don't have really time to go into that, but in biology classes, you'll see the same thing when they talk about plant reproduction. Okay. So then notice that the embryo. Let's look first at the fertilized egg. All right, it becomes the primary. We have the primary follicle. All right, then it develops into the mature follicle. All right, and then ovulation is where the follicle is released. Okay, so it basically breaks out of the mature follicle. Then what used to be the follicle now turns into what's called the corpus luteum, and the corpus luteum becomes a temporary endocrine organ that will secrete hormones then from that point on, until finally it fades away. It finally dries up, shrivels up, turns white, and becomes the corpus it's alb. Suddenly I forgot the name, but it's alb, the root word white. The corpus, it's not the corpus corpus luteum, corpus album. That's not it. It's white. I can't remember. I can't believe I just forgot the name. But it becomes the white body. It changes from the yellow body to the white body. Okay, so the sexual cycle in females averages 28 days, ranges anywhere 20 to 45. There's a hormone cycle, a hierarchy of control again, hypothalamus, pituitary, ovaries, uterus. The follicular phase, days 1 to 14, menstruations during the first 3 to 5 days, okay? This is when the uterus replaces lost endometrium and the follicles grow. So remember, this is when FSH is high and estrogen is high. Then the luteal phase, days 15 to 28, corpus luteum stimulates endometrial thickening, all right? The follicle turns into the corpus luteum. And then if there's no pregnancy, then the endometrium has to be lost, and that then becomes the basis for the menstrual period. The menstrual period, by the way, is not just blood. I'm sure all of you females know this well. There's tissue in there. It's kind of, viscous, gooey stuff that comes out. You're losing tissue. It's just very vascular tissue, and that's why it looks bloody, okay? So that's what's going on. It's supposed to happen, all right? Wow, there must be a fire, or, I don't know, maybe Godzilla. Maybe this is the day Godzilla comes. Lots of sirens. Okay, so which statement is false? Menarche, usually the first stage of puberty. Ovulation typically occurs around day 14 of the cycle. Most breast cancer are non-hereditary. Climacteric occurs due to an age-related depletion of follicles. Meiosis produces a diploid oocyte. Oh, this was a nasty question. Meiosis produces a haploid oocyte. I think that'll be the last time I ever asked that question.